But overall wasn't too bad. Honestly, the worst was the very last spots he did.
Yeah, I knew those were going to be your worst spots. That's why I did those last.
So I'm definitely still feeling the right side.
Yeah.
But it's a good thing. Yeah, really not too bad at all.
That's great. Dr. Jason, and I'm going to be doing here some treatments for myofascial pain along the cervical, thoracic, and the periscapular region for the patient here. One of the unique things that you have about the myofascial pain is that there are going to be taut little tender muscle and fascial bands that will fill here. And when you get to those areas too, not only do you feel those little knots and bands, but when you put pressure on them and when you're cleaning the patient, like we just did here with betadine and chlorhexidine, you get increased blood flow to those areas or a hyperemic response. So basically, I always tell the patients that their body gives me a little roadmap of to where they're hurting. So, traditionally, if you've ever had dry needling done anywhere in the past, or some acupuncture, that would be done, without having ultrasound. So we also use ultrasound. So I'm going to go through the palpatory process of feeling the little muscle knots that are in here, and then place this ultrasound over them as well. So we'll have both the visualization and palpatory feedback here in that standpoint. So I just had gotten to the palpated one of the little muscle knots here. So as you can see here, you're getting the muscle and the ribs, and so you can actually see the pleura. So you don't want to go very deep with these injections here, because that would risk a lung puncture if you go that area. So you can see the ribs here and here, and you can see the motion of her breathing in between here. So I'm going to get ready here. I'm going to do some cold spray here and keep this in my image here. So I'm going to come in, going to feel a little pinch. 1, 2, 3, and pinch. So I'm coming in nice and shallow. I can drop down a little bit deeper now that I've got more of a visualization of my needle tip. And I'm right into that muscle knot right in through here. So if you've ever had dry needling or heard of dry needling, there's a little bit of a needle fenestration that we do here. So we kind of fenestrate that needle in through here. Sometimes if you have a trigger point injection, which sometimes I'll also mention as wet needling, it's going to be using some lidocaine. And so we're going to stay in this area here. I'm going to give them some of the treatment cells. And so just doing a little bit of fenestration in that area. So we're going to do the same thing now on the contralateral side where she was having some muscle knots as well. I'm just going to palpate and feel that spot right here. I'm going to have some spray here. Doing some cold spray. So this one here, I'm more over one rib rather than spreading that over the two ribs, because that's where I best palpate it and visualize it right now. So I'm coming down here very gently, staying higher than not going as deep here from that standpoint. So I'm nowhere near the pleura or the intracostal space here, the area between the ribs. I'm going to do a little bit more treatment. And so I'm going to fenestrate while I do this as well. And you can see that fluid going in, spreading. And I move up. Just going to palpate a little bit more. Found another spot here. So I'm going to get that in my camera view with the sonogram. So there's the good picture of the knot. Here I'm going to get spray here. So again, I'm going to very gently come down in, advance here under the live imaging. So sometimes when you're doing these, you can get a twitch response, so which would cause that muscle to twitch here. So I usually say that's kind of like getting that double bullseye with that. So it's basically caused the muscle of spasm. You're trying to get in that center of that knot when you're doing that. So I'm just treating here and doing that fenestration as I'm going. All right, I'm just going to move up a little bit higher. Here, there's another one. Our patient has more more myofascial trigger points on her right side right now compared to her left, but she does have some on the left. So she does have asymmetry of symptoms, but still has some active but also latent trigger points on the left side. So latent trigger points are ones that aren't hurting her right now, even though you can feel the knot. So just because they're not hurting her today doesn't mean they're not hurting her at all. So I'll still treat some of those as well. And so I get another one here, coming back over to the left side. We'll spray here. A little pinch. Just going in. Doing that needle fenestration again, trying to stimulate that muscle. Try to release some of that spasm and then apply the treatment. And while I'm doing the treatment, here I'm also doing a little bit of fenestration. Again, trying to stay shallow. Palpate again right here. Cold spray there. So I'm working up from the thoracic periscapular area to the cervical area. You can also start it in the cervical area and the neck and then came down. So right, just doing a little bit of fenestration, the treatment again. Perfect. Come up a little bit higher. Now she has some of these knots here in that middle trapezius. We'll spray here. And then we'll get some in the upper trapezius as well. You can see as we're moving up her back, it's getting a little bit deeper, so I have some more room, more soft tissue. So I'm using an 1.5-inch needle, 27 gauge, so it's very thin. Try to use the one that's going to do the least amount of tissue damage, but also does good stimulation here. And I keep punch your needles just a little bit smaller than this. So right here, we'll cold spray there. Pinch here. Perfect. Do some needle fenestration. And then do some cells. Right up to here. These are some of the ones that bother her the most. So right up in here is that upper trap. Cold spray. Perfect. Got the little twitch there, so we got one of those little twitch responses here that I was talking about. So good. So that double bullseye area. But while I had found a really good spot, I'm gonna try to needle that a little tiny bit more. Try to loosen that up. All right, I'm gonna do one more on this side here. And cold spray. No pinch here. Perfect. So we're right there in the center of that knot, that upper trap. So doing that needle fenestration. I know these are the ones that were bothering her the most on my exam here with her, so I wanted to try to do those last. So that way, in case it did cause a little bit of twitching, which we are getting, the patient was going to be, well, not thinking about that, maybe little spasms that we get during the treatment. So, which is a good thing though to get them. So we're going to get right in that double bullseye spot. So, all right, here's the last little bit of cells for the treatment, and we are done. So overall, one of the things I always will mention to the patient too is we did a good bit of needling, even though they were really small needles, and we were doing that. One of the most common complications with any needle stick, whether it's a blood draw or trigger point injections or acupuncture, is a vasovagal reaction. So I always let them know they might get a little lightheaded and dizzy. So when I'm going to have her sit up here in a moment, I'm going to tell her to take her time and just lay there for a moment there. Just because, one, we're hitting a lot of painful areas. I'm already pushing on them, making them, hurt, and then I'm needling them and then placing fluid in there. So, so sometimes that can get her autonomic nervous system up, so that fight or flight kicks in, and so which can cause that vagovasal reaction. So, post care, you could do, soft tissue massage, light exercises. I go through stretches with the patients, whether it's the neck and upper back. So we're doing cervical and shoulder range of motion to get that periscapular area. If it's the low back, we do the same there for some hip and low back. So heat is your friend here. We want to put a little bit of heating pack on there as well. So, and with that, we'll follow back up with her and see how she's doing. So thank you very much.